Hello and welcome everyone to today's webinar hosted by Sajida's Mental Health Programs and in partnership with Dhaka Tribune. Today is a special day since today is World Mental Health Day, and the motto for World Mental Health Day in 2021 is Mental Health in an Unequal World. So today, which is 10th of October, it's a weekday. It has been a busy day for many of us. So I hope everybody is joining us এবং সবাই আমাদের সাথেই থাকবেন কারণ আজকে আমরা বিশেষ কিছু আমাদের সাথে গেস্টরা থাকবেন তাদের সাথে আমরা কথা বলবো এবং আমি একটু প্রথমে শুরু করব একটা ডেসক্রিপশন দিয়ে যে আমরা কি নিয়ে কথা বলবো আমাদের আলোচনাটা কি নিয়ে হবে সো let me start with an introduction. Today on 10th October we are here to observe the World Mental Health Day, which I've already mentioned. This is our fifth webinar of Sajida Mental Health Campaign. Every year on 10th October, World Mental Health Day is observed as an international day focusing on a particular theme for promoting global mental health education, awareness, and policy advocacy. The overall objective of World Mental Health Day is to raise awareness of mental health issues around the world and to mobilize efforts in support of mental health. The day provides an opportunity for all stakeholders working on mental health issues to talk about their work and what more needs to be done to make mental health care a reality for people worldwide. This year's World Mental Health Day comes at a time when our daily lives have changed considerably as a result of the COVID-19 pandemic. এই ব্যাপারটা নিশ্চয়ই আপনারা সবাই অনুভব করছেন যে প্যান্ডেমিক হওয়ার কারণে আমাদের জীবনটা বেশ অন্যরকম হয়ে গিয়েছে এবং এটা আসলে আমাদের মানসিকভাবে আমরা কেমন আছি সেটাকেও অনেকটা এফেক্ট করছে। The COVID-19 pandemic has increased inequalities in human development by causing more incidents of mental disorders and disrupting already limited mental health services. 2020 highlighted inequalities due to race and ethnicity, sexual orientation, and gender identity, and the lack of respect for human rights in many countries, including for people living with mental health conditions. Such inequalities have an impact on people's mental health. Moreover, many people with a mental illness do not receive the treatment that they are entitled to and deserve, and together with their families and careers, continue to experience, and their carers continue to experience stigma and discrimination. The gap between the haves and the have-nots grows ever wider, and there is continuing unmet need in the care of people with a mental health problem. তো যাদের মানসিক মানে কোনো একটা দুর্বলতা বা অসুস্থতা আছে তাদের জন্য এই কোভিডের সময়টা বোধহয় আরো বেশি কষ্টকর হয়ে দাঁড়িয়েছে কারণ দেখা যাচ্ছে যে যেই ধরনের ফেসিলিটি যেই ধরনের সার্ভিস পাওয়া দরকার সেটা তারা পাচ্ছে না তো এই ব্যাপারগুলো নিয়েও আজকের আলোচনায় আমরা কথা বলবো So this year the World Federation for Mental Health WFMH has announced the theme to be mental health in an unequal world তো তার মানে এই বছর যে ওয়ার্ল্ড ফেডারেশন ফর মেন্টাল হেলথ বলেছে যে আমাদের এই বছরে আমাদের যে টপিকটা হবে সেটা হচ্ছে এই যে মানুষের মানসিক সুস্থতা বা মানুষের মানসিক স্বাস্থ্য যে আমরা যে একটা পৃথিবীতে বসবাস করি যেখানে আসলে আমরা মানে আমরা সবাই ইকুয়াল তা না হয়তো ওরকম একটা জায়গায় মেন্টাল হেলথটা কোথায় দাঁড়িয়ে আছে বা মানসিক স্বাস্থ্য মানুষের কোথায় দাঁড়িয়ে আছে কি করণীয় This is a response to the increasingly polarized world, with the very wealthy becoming wealthier and the number of people living in poverty remaining far too high. This subject was chosen by a global vote, encompassing the WFMH members, stakeholders, and supporters. The goal is to help raise mental health awareness, and each of us can make a contribution to ensure that people living with mental illness can live better lives with dignity. The 2021 World Mental Health Day provides an opportunity for us to come together and act together to highlight how inequality can be addressed to ensure people are able to enjoy good mental health. That is why today's webinar focuses on the importance of mental health in the present economic situation worldwide on the occasion of World Mental Health Day 2021. তো এখন আমি সবাইকে একটু জানালাম আমরা কি নিয়ে কথা বলবো, আমাদের বিষয়টা কি, এবং এখন আমি স্বাগতম জানাতে চাই আমাদের গেস্টদেরকে যারা আছেন আমাদের সাথে। I would like to welcome our esteemed speakers for today and discussants for today. We have with us Hasina Momotaz, National Professional Officer, Mental Health, World Health Organization. Ms. Momotaz, how are you doing?
Thank you, Ms. Ria. I'm fine. And welcome everyone to this webinar. Thank you.
ধন্যবাদ আমাদের সাথে থাকবার জন্য। আমাদের সাথে আরো আছেন নাজিশ আরমান। শি ইজ দ্য লিড কোঅর্ডিনেটর কন্টেন্ট ডেভেলপমেন্ট সূচনা ফাউন্ডেশন। হাই মিস আরমান।
Hi, thank you for inviting me here today. I'm really looking forward to the discussion.
Great. We also have with us Mutas Sabib Rumman Matin. He's the training and operations specialist of Kanpete Roi. Mr. Matin, কেমন আছেন? Thank you for joining us.
Thank you for inviting me. ভালো আছি।
আর জি আর সব সময়ের মতো আমাদের সাথে আছেন ডক্টর আশিক সালিম, হেড অফ সাজিদা মেন্টাল হেলথ প্রোগ্রাম। Dr. Salim, I hope you're well this busy weekday.
Yeah, it has been a busy day. I just got home and looking forward to today's session.
Great. আমি আর দেরি না করে আসলে আমাদের যে টপিকটা এবং আমরা যা নিয়ে ডিসকাস করবো সেটা দিয়ে শুরু করতে চাইছি। সো আমরা তো সবাই, যেটা আমি বলছিলাম ইন্ট্রোডাকশনে, যে আজকের থিমটা হচ্ছে মেন্টাল হেলথ ইন অ্যান আনইকুয়াল ওয়ার্ল্ড। তো আমি প্রথমেই প্রশ্নটা করতে চাই হাসিনা মমতাজকে, যে এই বছরের যে থিম বা প্রতিপাদ্য বা দ্য থিম দ্যাট উই আর টকিং অ্যাবাউট, মেন্টাল হেলথ ইন অ্যান আনইকুয়াল ওয়ার্ল্ড, what does it mean and how do you define this, or would you please like to elaborate a bit more on this?
Thank you, Ms. Ria, and also thank you to Sajida Foundation to arrange this webinar and to invite WHO. First of all, I would say that Ms. Ria have already have some background about how the mental health day is observed in each country, and the primary background she shared with us. Today is the World Mental Health Day. It is actually established by the World Federation of Mental Health in each year, and they have provided some themes. So this year the theme is mental health in an unequal world. So this is actually highlights that the access of mental health services in all over the world is unequal, and the situation is almost similar to Bangladesh. And this day will focus the mental health inequality in locally and both globally, and also to for some action that what can we do from our point of view, from our country, from our locality, how we can move forward in this regard. You know that already the stigma, discrimination, and mental health is a most neglected in all over the countries, most of the countries. And Bangladesh is not very much different from the other countries. We have also some misconception, lack of knowledge regarding the mental health issues. As we have seen in our last National Mental Health Survey, that more than 18% of adults and more than 12% of children are suffering in some form of mental health disorders. But where this person are getting any services, is these services are equal for all of those? We know that our treatment gap is also very high. It is for actually the 94% for the adults and 92% for the children. So this rate is very high. So this is also alarming. And we have also very low resources for mental health, and those are unequally distributed in many of the regions. Like in the urban areas, there are many mental health professionals who are providing the services, but in the rural areas, the persons are getting enough services from the mental health professionals. It is not. We know the current situation. So and also we know that there are some types of population. We are saying that the vulnerable group of population, specifically the women, the children, and the persons who are living in slum or who are living in the prison, or in the displaced population also, if we think that So this population are very much vulnerable and uh, have a chance to get the mental disorders more than the general person if we compare with the general population. So if those persons are getting enough services at this moment, in this context we are saying that this is an unequal distribution and we have to manage this inequality, especially regarding the mental health issues. And also we know that the COVID pandemic has majorly disrupted our services. We have actually conducted a survey on the mid 2020. So it was conducted all over the world, and also in Bangladesh participated in that study. It reveals that there are severe disruption in the mental health services during the COVID pandemic in all over the world. So in cases of Bangladesh, the inpatient and outpatient services both became low during the COVID pandemic. So the person with the severe mental health disorders, they are also getting unequal services during the COVID pandemic. And also, as our resources are very low, so our doctors, nurses, and primary healthcare providers, they have also very much vulnerable in the during the COVID pandemic to provide the services, and some of the persons burn out. So if they get equal services like the other persons compared to the general populations, so we have to address these things and we have to work on these issues. That if we are thinking about the human rights, if we are thinking to achieve the SDG goals and the universal health coverage, we want to achieve that, we have to think about this stigma, discrimination, human rights issues, so that we can make this world unequal, especially in cases of mental health. So I will say that we have to work together with the NGOs, INGOs, and also with the civil society organization. Government have to work together with all the organizations to achieve this universal health coverage. And another issue I would say that I have taken actually talking so much negative, but there are also some rooms for the optimism and hope. We have achieved already so many things. We know that our population is very high comparing to the other countries. So it although it was very difficult, we have some good examples that we have already created. There is a strong political commitment for mental health in our country, and also the Mental Health Act was already passed, which is focusing on the human rights, and also the mental health policy is in final stage, and mental health strategic plan is already finalized. Maybe Ms. Najish will talk about more with these issues. So these documents actually focus on the community-based mental health services that we have already started in Bangladesh. We have conducted some mental health gap action program, that is evidence-based program that is happening in most of the countries, and it was very much successful in Bangladesh. Although we have a huge population of the FDMS, forcibly displaced Myanmar population, we have provided some mental health services to those persons also. So these are our highlights that we have already created. This is an example to many other countries, and we are also thinking about to implement the another WHO evidence-based model, that is the quality rights toolkits. It is mainly based on the human rights. So we think that this shortage we can overcome this, and also there's the mental health resource shortage. We can also work on that. So there are some good things, and also we are providing some services. Bangladesh have recently joined the one initiative, that is special initiative for mental health. This is the first 13 countries that have included in all over from all over the countries. They have selected to they do some activities like the good governance for mental health, strengthening the situation, strengthening the system reforms, and also service coverage. So we are working on these issues, and Bangladesh have already selected and started working for the special initiative for mental health. So we have actually many things, and I have already told about the service disruption. I have told about the treatment gap. Treatment gap is so high, but the 6 or 8% people that are receiving service, where are they going? They are going to the mental health professionals. This is one positive thing. They are not going to any traditional healer. Most of them are going to the mental health professionals. So they are on the right track. So it is also very much important that what we are thinking is and how we are planning next. So I think that we can also hear from some of our speakers and audiences if they have any questions or anything to say. Thank you.
থ্যাংক ইউ সো মাচ মিস মুমতাজ। আপনি যেটা বলছিলেন আমি যদি একটু সামারাইজ করি সেটা হচ্ছে যে আসলে আমাদের দেশে তো বেশ মানে আনইকুয়াল বলতে আমরা যেটা বুঝি যে আমাদের বেশ কিছু সবার সবার কাছে হয়তো মেন্টাল হেলথ সার্ভিসেস চলে যাচ্ছে না। প্রায় 94% অ্যাডাল্টসের জন্য এবং 92% 92% শিশু এবং 94% যারা অ্যাডাল্ট তাদের জন্য একটা ট্রিটমেন্ট গ্যাপ রয়ে যাচ্ছে। কিন্তু আবার আপনি ইতিবাচক কথাও বলেছেন, মানে এগুলো যে একটু নেতিবাচক কথা। ইতিবাচক কথার মধ্যে হচ্ছে যারা পাচ্ছে, আপনি যখন বলছেন 6 to 8% যারা পাচ্ছে ট্রিটমেন্ট, তারা কিন্তু মেন্টাল হেলথ প্রফেশনালদের কাছ থেকেই পাচ্ছে। তো সেটা আবার যেরকম একটা পজিটিভ দিক। আবার কিছু আমাদের যেই কারণে মানে এই সিনটা যদি সেট করেন খুব সুন্দর করে আপনি বুঝিয়েছেন যে ভালনারেবল গ্রুপ যারা আছেন, প্রিজনে যারা থাকেন, মানে কারাগারে যারা থাকেন, যারা ডিসপ্লেস পপুলেশন, যারা তাদের দেশের থেকে অন্য দেশে আমাদের এখানে এসে থাকতে হচ্ছে, রেফিউজি স্টেটাসে থাকতে হচ্ছে, তাদের হয়তো ঠিকমতো কোনো তারা সার্ভিস নিতে পারছে না বা প্রোভাইডেড হচ্ছে না। সো এইরকম কারণে অনেক ধরনের ইনইকুয়ালিটিস আছে। আমাদের সবাই একই রকমভাবে আমরা একই জায়গায় নেই। এবং কোভিড 2020-র কারণে যেটা আমিও আগে বলছিলাম যে অনেক ধরনের ডিসরাপশন তৈরি হয়েছে, সার্ভিসে ডিসরাপশন তৈরি হয়েছে। ইনপেশেন্ট আউটপেশেন্ট সার্ভিস অনেকেই পায়নি। যাদের অনেক গুরুতর মানসিক স্বাস্থ্য মানে অসুস্থতা আছে তারা হয়তো অনেক সার্ভিস পাওয়ার সুযোগই পাননি অনেক দিন। তো আমাদের এই জায়গাগুলোতে কাজ করার আছে। আইএনজিও এনজিওরা মিলে একসাথে আমাদের কাজ করতে হবে যাতে আমরা একটা একটা মানে আমাদের তো এখনো অনেক পথ পেরোনো বাকি, যাতে আমরা সেটা পেরিয়ে আগাত পৌঁছতে পারি। তো আপনি যে পজিটিভ দিকগুলোর কথা বলছিলেন, অপটিমিস্টিক কথাগুলো বলছিলেন, সেটা হচ্ছে যে আমাদের অনেক ম্যান্ডেট আছে, ন্যাশনাল ম্যান্ডেটস আছে, যেগুলোর কারণে হয়তো আমরা পজিটিভলি ভাবতে পারি। এবং সেই ব্যাপারেই আমি একটু চাচ্ছি যে আমাদের নেক্সট যিনি স্পিকার নাজি শারমান, উনি যদি একটু বলেন যে হাউ ইজ দ্য ন্যাশনাল মেন্টাল হেলথ স্ট্র্যাটেজি অ্যাড্রেসিং দ্য ইস্যু অফ মেন্টাল হেলথ অ্যান্ড ইনইকুয়ালিটি।
Thank you. Um, so I think I'll just start off by saying that I'm not sure if everyone knows this, but it's important to note that Bangladesh as a country is actually one of the first countries in the WHO Southeast Asia region to place mental health as one of its top 10 priority health conditions, which we still don't see in a lot of developed countries around the world. So, unfortunately, when the annual health budget is allocated, in the case of Bangladesh, it's less than 1%. And medical training institutions allocate less than 5% of the curriculum on teaching health professionals about mental health and well being. So, in order to address these gaps, there was no way forward but to develop a comprehensive mental health action plan. So, like Hasinapa mentioned, we've had some major achievements over the last few years. We've just passed a new Mental Health Act in 2018. We're in the process of endorsing our national mental health policy. And that national mental health policy was used as a framework for developing the National Strategic Plan. So, I think the main things that we focused on when we were doing the strategic plan was to make sure that it's multi-sectoral, because like Hasinapa mentioned, we all need to work together. So when we developed it, we made sure that all stakeholders were involved: professionals, government representatives, NGOs, INGOs, and most importantly, persons with lived experiences, because often their voices are not reflected, but they're the ones that we need to hear from the most to make sure that the plan is a holistic one that addresses the needs of everyone. So when we developed the mental health strategic plan, our vision was to establish a plan that will help provide mental health at all levels of the healthcare system, primary, secondary, and tertiary, because we have a lack of trained professionals now to address the needs of our growing population. So we're focusing on community-based mental health services so it can help facilitate access to quality mental health services for all people. And based on the principles of universal health coverage, we're also trying to increase access to vulnerable groups of the population. So, for the strategic plan, we kept it in line with several global plans and charters. Most importantly, we've aligned it with the objectives of WHO's Comprehensive Mental Health Action Plan. And if you look at the four general objectives, you can see that our goal is to try and reduce the gap and reduce the inequality. So I'll just go through the four objectives that we have. I think that'll help give everyone a better understanding of how our plan has been designed. So the first one we focused on was to strengthen effective leadership and governance for mental health, to provide comprehensive, integrated, and responsive mental health and social care services in community-based settings, to implement strategies for both promotion and prevention in mental health, and of course, to strengthen information systems, evidence, and research for mental health. So we have developed the plan through a series of focus group discussions, literature reviews, program evaluation reports, one on one key informant interviews with persons with lived experience. And I think the plan that we've come up with is a very comprehensive one, a very holistic one, and we've tried to address the needs of all groups of the population. And once it's been finalized, I hope that it can be easily implemented with our existing healthcare infrastructure. Thank you.
Thank you. That was good to hear. In summary, if I say, as Arman said, that আমাদের যে মেন্টাল হেলথ স্ট্র্যাটেজিক প্ল্যান সেটা কিভাবে বাস্তব মানে কিভাবে ওটাতে আসা হলো, কি ধরনের ফোকাস গ্রুপ ডিসকাশন করে, রিসার্চ করে, কিভাবে যাতে হোলিস্টিক একটা প্ল্যান হয়, সবাইকে ফোকাস করা যায়, সবার নিডগুলোকে আমরা যাতে বুঝতে পারি, সেখানে যাতে অ্যাড্রেস করতে পারি, সেই কথাটা মাথায় রেখেই এই প্ল্যানটা করা হয়েছে। এবং যাতে মানে আমাদের গভর্নমেন্ট এই প্ল্যানের কিছু চারটা অবজেক্টিভ আছে, সেটা উনি খুব সুন্দর করে আমাদেরকে প্রেজেন্ট করেছেন। তো আমি একটু নেক্সট আমাদের যিনি স্পিকার ওনার কাছে যাওয়ার আগে আমি একটু সবাইকে জানিয়ে দিতে চাই যে আপনাদের যদি কোনো মেন্টাল হেলথ নিড থাকে আপনারা কিন্তু কল করতে পারেন সজনে at 9678771611, কান পেতে রইতে at 01985275286, আর সাজেদার হেলথ হটলাইনে at 9678771511। আমি চলে যেতে চাচ্ছি আমাদের নেক্সট ডিসকাসেন্টের কাছে, যার সাথে আমরা কথা বলতে চাই। মিস্টার মাতিন আছেন আমাদের সাথে, এবং মিস্টার মাতিন আপনার তো অভিজ্ঞতা আছে ইন গেটিং, আপনি বোথ ইনপেশেন্ট এবং আউটপেশেন্ট মেন্টাল হেলথ সার্ভিস বাংলাদেশে পেয়েছেন, এবং আপনার কাছে জানতে চাই হাউ উড ইউ কানেক্ট উইথ টুডেজ থিম in regard to your experience or observation in accessing mental health services in Bangladesh, and what are some of the intervention options available for this group?
আমি কিছুটা পজিটিভ কথা বলতে চাই, যেটা হয়তো weird but it's positive in a sense যে I was in an inpatient facility in one of these very expensive places very expensive inpatient facilities, and I have also seen inpatient facilities at Dhaka Medical College because I've been there a lot of times, and there are advantages of being at Dhaka Medical College. The advantage is that you have a relative or a friend or whomever who is always there with you and who is providing sort of the safety that you need and the conversation that you need. The nurses are there just probably to give you the medications 3 days, 3 times a day, or the injections or whatever. But you're actually being cared for by people you love. On the other hand, in these very ultra expensive places, you'll never get to see your parents ever. You'll never get to see a friend. Spend 3 weeks, 4 weeks, 3 months in a place without any communication with your loved ones. You're just a healthy person. Just think of what will happen. Even in prison, you get to write letters or something. I did. This is for me just I don't understand why this is done, especially for people with simply a mental health diagnosis and no issue with drug abuse or anything of that sort. And in fact, I told my family that if you need to place me in a locked facility, place me in DMCH because there I can be cared for by you. So, yeah,
মানে থ্যাংক ইউ ফর দ্যাট যে আপনি যেরকম আমি একদম অনেস্টলি বলবো যে আমি যখন এই মডারেশন করার আগে আমার একটু বসা হয় টিমের সাথে যারা পুরো ওয়েবিনারটা অর্গানাইজ করে স্পিকারদের অর্গানাইজ করে তো আমাকে বলা হচ্ছিল যে আপনার ফার্স্ট হ্যান্ড এক্সপিরিয়েন্স আছে আপনি এবং আমি তখন জিজ্ঞেস করছিলাম যে আপনি কি এটার ব্যাপারে কথা বলতে খুব কমফোর্টেবল বা আর ইউ ওপেন অ্যাবাউট অ্যাবাউট টকিং অ্যাবাউট ইউর ওন জার্নি তো আপনি যদি আরেক মানে if you don't mind would you like to for our listeners or our viewers like to speak about your journey a little bit যে আপনি মানে আপনি as a person কারণ আপনি তো নিজে কিছু মানে মেন্টাল হেলথ ইস্যুস ফেস করে ট্রিটমেন্ট নিয়ে একটা জায়গায় এসেছেন নিজেকে নিয়ে এসেছেন এবং নিজেও আপনি এখন এই লাইনে এখানে রিলেটেড কাজই করছেন তো এই ব্যাপারে যদি একটু কথা বলেন এবং আপনার কাছে কি মনে হয় আজকের যেটা দ্য মোটো অফ টুডেজ mental health in an unequal world if you would like to elaborate a bit about that you've explained your experience private expensive institution versus public but overall what your journey has been like and you know
yeah. I guess my issue started when I was in class 4. Uh, I mean, looking back, it was a depressive episode, but it manifested itself in having pain in my eyes. But that was just a psychosomatic thing. Uh, so after that, uh, around the times when I was taking my A-level tests, I had depression and sort of had that on and off ever since. I went to university in the US, stayed there for 2 years, but again, severe depression, and then ultimately it turned out to be bipolar disorder. So I've been in locked facilities in the US too, 2 times. The first time I was depressed, and I went the second I mean, it was a court ordered, mandated sort of stay. So that was the second time. And after I came back to Bangladesh, the third time was in that, super expensive place. So again, my experiences with that and this, for instance, is that in America, they used to let my family come in. They used to let my dad come in. They used to let my friends come in. And they could come in every single day and stay there for hours. Yeah, they had a visiting time, sure, but they could come in and stay with you for every single. I mean, this for me is just cruel. Yeah. But yeah, the thing is, with my mental illness, I've never really gotten back to occupational, I mean, sort of previous level of occupational aptitude. So, yeah, I mean, occupational, I am impaired, not just during periods when I have mania or depression, but even when I am asymptomatic, I have occupational limitations. But I'm very fortunate. I have a very supportive family and a very supportive wife, and yeah, great access to mental health services here. So yeah, I'm very fortunate on that front, definitely.
Thank you for explaining that. What has your journey at Kanpete, Roy, or what your experiences there have been like, and what are you?
Kanpitiru has been a huge blessing in my life. Uh, Basically, I was friends with Yashim from school. We were classmates. Since I knew we knew each other since we were in seventh grade. Uh, of course, she knew my issues, and so they kind of made a place for me in Kanpitiru. And yeah, they've really sort of gone out of their way to help. Uh, I mean, there was a period of like 6 or 9 months when I was really not in control, and they still continued to, you know, uh, provide me room, and they still let me come into the office and whatever. So that's if you want sort of a model kind of place for a mentally ill person to work, or someone with disabilities who needs uh, accommodation to work, then that would be Kanpitiru. It's,
থ্যাংক ইউ সো মাচ। সো আমাদের সব আমাদের যারা ভিউয়ার্স তাদের জন্য একটু বলতে চাই যে আমাদের কথা হচ্ছে আজকে আজকে তো আপনারা সবাই জানেন যারা দেখছেন হয়তো যে আজকে 10ই অক্টোবর এবং আজকে ওয়ার্ল্ড মেন্টাল হেলথ ডে এবং এবারের মতো দ্য থিম ফর দিস ইয়ার্স মেন্টাল হেলথ ডে ইজ মেন্টাল হেলথ ইন অ্যান আনইকুয়াল ওয়ার্ল্ড। সো আমরা বিভিন্ন ব্যাপারে কথা বলছি আমাদেরকে আমাদের প্রথম যিনি বক্তা তিনি বলছিলেন মিস মুমতাজ আমাদেরকে বলছিলেন পুরো সিনারিওটার কথা আমাদেরকে নাজি শারমান বললেন যে ন্যাশনাল ম্যান্ডেটটা কি আমরা মিস্টার মার্তিনের কাছ থেকে শুনলাম যে কিভাবে ওনার জার্নিটা কি ছিল as someone who has received both inpatient and outpatient mental health care. So now I'd like to go on to Dr. Ashik Salim. And I would like, Mr. Salim, Dr. Salim, I'd like you to elaborate on Sajida's mental health program and its vision and talk about its vision to provide quality mental health services to people from all socioeconomic backgrounds, and how Sajida Foundation as an organization is doing this, and where does Sajida Foundation contribute to reducing inequality in accessing mental health services?
Thank you for that. Yeah. So I'm just going to divert a little bit away from our script and make some
Yeah, please.
comments and make some comments on what we've heard so far. So first of all, I'd like to thank Matin for sharing his story. Um, I mean, I've worked as a doctor in abroad and Bangladesh, and worked with people with lived experience, and it's always it's not easy, and most people don't want to do it. But whenever individuals do come forward with their story, for us it's extremely important, because this platform today, we have a mix of. I mean, I'm a professional. Martina is a service user, and we have two guests who are from the policy side of things. And so for us to be able to discuss this in one platform, it really, really helps us to make sure that we uh, design services and then conduct our services in a manner in which the users who the services are for, that they feel heard. um, so, just to give you a bit of reflection, today we were at Sajada, and we're talking, we have all these big plans. We want to do this, we want to do that, and we're talking about, hospitals and what can we do, and this is one point which I bring up all the time, that I honestly feel that, if there is a carer who wants to come in with a service user, then they should be allowed, if the person is supportive, rather than. And but the problem there in Bangladesh is that we actually, in the private sector, we don't have a single mental health treatment facility. We have drug rehabilitation centers that admit mental health patients with mental health problems and treat them. So the structure is that they are drug rehabilitation centers, and they treat people with mental health problems. So we don't have a single unit. It's not a single unit in the private sector which does that. Whereas Dhaka Medical, NIMH, Pabna Hospital, they are all mental health treatment facilities. So that's the difference. And going to what Shreya was saying, is that in the private sector, such as the foundation, we are looking to look at that gap so we can hopefully create the first mental health treatment facility, inpatient facility for those who can afford it, but providing it evidence-based with discussion with service users to make sure that it is, we can address people's needs and not make it a traumatic experience. Because for the majority of people, and you can correct me if I'm wrong, Mateen, but actually the majority of inpatient admissions are actually more traumatic than they are healing in if the environment isn't right. So I've actually treated people for PTSD who have come out of inpatient. So it's extremely difficult. So so thank you for that. It's much appreciated, and I'm sure we'll connect more regularly. So that's the first thing. The second thing I wanted to just reflect on is is not as, and as both mentioned, that we have now laid the foundation. We have we have our policy, we have the plan, we have the act. It's in place, and that's why our webinar is what can we do? What are we going to do about it? We've got the plans there. The government has the strategic plan, is there's the action plan there as well. So so the and also Hasina mentioned how we all need to work together. So so absolutely, we're at the point now where we need to start doing things. Lots of people have the intention. From what I know, there's lots of people who actually want to provide funds to do this work, and we just need to get together and do it. So I feel that we're in a really, really interesting time right now, and if we all coordinate and make sure that we do it in the right way, using evidence and using consultation, we'll be able to make services and address mental health in general for everybody in a collaborative way. Um, the next thing I just wanted to say is, before we go into what Sajada Foundation is doing and would like to do, I'd just like to mention that because I'm saying that we need to do something about mental health, I think it needs to go down to an individual. The responsibility needs to go down to every individual, right? Because every single one of us can do something about mental health, you know. So just give you a little example. Once upon a time, you couldn't get, let's say, vegetable oil in the market, and we all used to use, different types of oil to cook. But when we became aware that hydrogenated fats are not good for you, we all gradually, slowly shifted over to vegetable oil, and it was a health campaign. When we realized that having salt in our diet is not good for our blood pressure, we started telling people. We said, listen, that's not good for you. Cut down your salt, cut down your fat, reduce carbs, cut out, don't give sugar to children. The number of children who don't get Coca-Cola now is phenomenal. But when we were young, we didn't know, so we just had it. So being healthy mentally is our all responsibility, and we can do so many things to address that. So first of all, as individuals, if we have children, the way we conduct our families, the way we have stress in families, we can reduce stress and have healthier. Our children go to schools. We can ask our schools to make sure that they have counselors. We can, um, uh, you know, we can ask for our schools for the teachers to have certain training, because we do have lots of people who are available to provide training. The mental health first aid is a very good example. It's an easy training. It's easily done. It's evidence based, and it can be easily provided large scale to large numbers of people. So we can do that. At work, we all are either employees or we're employed, right? So, um, and those of us who are, again, we can provide a healthy environment at work. If people are getting bullied, we can step up for them. If people are facing some kind of abuse, we can stand up. We can ask for our employers to provide us with some kind of support, some kind of help. It's available. And these are all relatively cost effective. Health insurance is now commonly given, so why don't we get, but health insurance doesn't include mental health support. So we can campaign that. So us as employees and employers, there's a lot we can do. And finally, within the family, like I mentioned earlier, we can try and have healthy family structure. There's I heard I heard a comment a really long time ago, and it said that if you have one meal sitting at a table once a day as a whole family, that family will be healthier. And this is, I find this resonates so much, because you're sitting around, you're talking, you're communicating, and if you can do that, then it probably means there isn't large amounts of conflict. So it allows us to be healthy that way. So, just I wanted to mention that because I'm thank the speakers for their comments, and these are my reflections of what we've heard so far. I'm taking well over my time, uh, but I'll briefly just say what Sajida is doing. So at Sajida, we've formed a mental health program, which has essentially happened very organically. It's happened organically because we were hearing what about the all the initiatives that are being taken by the government, and we feel that that there are parts where we can play a role. There are parts that can be filled across the country, because today's webinar is about mental health inequality. And no matter how many services you put in, you'll always exclude somebody. Whenever you do something, you always exclude somebody. So, and if you open up for everybody, then it's still excluding people because there's people who cannot access it. So there will always be gaps, and we would like to try and fill them. So we're doing a few small initiatives, which are essentially their trials, their projects, to see if they will work, and hopefully they'll work, and we'll be able to scale them up. So right now, what's working is we have Shajun. So the number is on the ticker at the bottom. There's a few questions and comments about number, where people can go to get help. So there's the number for Shajun. If you give Shajun a call, you can speak to a counselor. And again, this program came up with a collaboration that we did during COVID, between between PHWC, Sajida, and Kantitiroi, and we had counselors from BRAC, and we all got together and we did a helpline which provided free counseling. That finished within 6 months, and then we decided to continue using that model to provide free counseling. It's one-off session, but and it's being done by junior counselors who are being supervised by senior counselors. So we're trying to use that model to provide cost-effective care. Shahjahan also has trainee doctors who are in the mental health training process, and they can also provide assessment. Again, the interventions they give are provided in supervision by the senior doctors within our team. So we're providing some care over. So it's a tele-consultation service. There's no physical care, and we're trying to do this on a small scale, but it's increasing. Right now, we're in the setup stages. We, other than that, obviously, we're working within Sajda Foundation to provide good quality mental health care to our staff. So we try and do that. We have a few projects in the pipeline. So Mateen mentioned about employability, and I think that this is a big issue that very often when we think about services, we think about treatment, but we need to move. That has to happen, yes. But alongside that, we also need to think about functionality. So yes, you get rid of symptoms. Somebody's hearing voices, you give medication, voices are gone. Now what? That's the easy bit. The now what is that we need to get OTs involved. We need to get therapists involved. We need to get people, uh, you know, back to work. And if they can't work, need to be able to get them to at least be looking after themselves. So we're looking at training. So we're looking at providing training, have staff who are available in the training. We're looking at, like I mentioned earlier, a residential facility which will be functional based, so not hospital based because the government has extra facilities. There's no need, but we can focus on functionality. So rehabilitation for mental health illness or mental illness. So those are a few of the projects. There's a few other ones in the pipeline, but right now what's happening actively is Trajon, the training, and our occupational therapy residential facility for people with mental illness. So that's what we're doing at the moment.
Thank you so much, Dr. Ashik Salim, for that. I just want to kind of আমি যদি আমাদের সব ভিউয়ার্সদের ক্যারেক্টার সামারাইজও করতে চাই যে সেটা নিয়ে একটা কথা হচ্ছিল মিস্টার মাতিন যেরকম বলছিলেন যে প্রাইভেট ভার্সেস পাবলিক আমাদের এখানে যে ধরনের সার্ভিসেস দেওয়া হয় ফ্যামিলির সাথে দেখা করা এটসেট্রা সেটার একটা খুব ইন্টারেস্টিং পয়েন্ট ডক্টর সালিম বললেন যে আমাদের দেশে আসলে প্রাইভেটাইজড মানে মানে রেসিডেন্সিয়াল মেন্টাল হেলথ সার্ভিস আসলে কিছু নেই বেশিরভাগই হচ্ছে ড্রাগ রিহ্যাবিলিটেশন সেন্টার যেখানে অনেকেই ভর্তি হচ্ছেন ভেবে যে তারা সেখানে মেন্টাল হেলথ সার্ভিস পাবেন সেটা কিন্তু নেই তো সেই জায়গাটায় আসলে সাজেদা কাজ করার চেষ্টা করছে সেটার কথা উনি ইলাবোরেট করেছেন কিন্তু তার আগে উনি এটাও বলছিলেন যেটা আমার মনে হয় অনেক ভিউয়ারদের জন্য এই এই বিষয়টা আসলে জরুরি মানে চিন্তা করা বা এটা নিয়ে কাজ করা আমরা বলতে পারি যে আসলে আমাদের প্রত্যেকেরই কিছু করণীয় আছে আমরা প্রত্যেকেই কিছু করতে পারি মেন্টাল হেলথ অ্যাওয়ারনেসের ব্যাপারে বা মেন্টাল হেলথকে একটা আরো ইতিবাচক দিকে নিয়ে যাবার ব্যাপারে যাবার জন্য যেরকম একটা হচ্ছে কথা বলা অ্যাওয়ারনেস রেজ করা আমরা যেরকম আমাদের ফিজিক্যাল হেলথ কোনটা খেতে হবে না বেশি চিনি খাওয়া উচিত না স্যাচুরেটেড ফ্যাট খাওয়া উচিত না এগুলো নিয়ে আমরা আলাপ করি আমরা আমাদের বয়োজ্যেষ্ঠ যারা আছেন আমাদের চারপাশে তাদেরকে বলি আমরা ইয়াংরাও চেষ্টা করি এক্সারসাইজ করা উচিত এগুলো নিয়ে কথা বলি সেরকম মেন্টাল হেলথ বা মানসিক সুস্থতা মানসিকভাবে মানসিক স্বাস্থ্যটাকে কিভাবে ভালো রাখা যেতে পারে এটা যে খুব একটা স্বাভাবিক বিষয় মানে আমি খুব এটা খারাপ শোনাবে কিন্তু একটা সময় ছিল যখন আমরা কথা মানুষ বলতো ও তো পাগল এই পাগল হয়ে গেছে ওকে ওর মাথা খারাপ হয়ে গেছে কিন্তু এই মাথা খারাপ হয়ে গেছে থেকে আর আমার ধারণা আমি জানি না হয়তো আমার পরিবার আমি খুবই সৌভাগ্যবান আমার পরিবার আমার বন্ধু বান্ধবরা এই ব্যাপারটায় সচেতনতাটা বৃদ্ধি পাচ্ছে বলে বা তারাও জানে বলে তারা বুঝে যে একটা মানুষের মানসিক স্বাস্থ্যকেও ভালো রাখাটা খুব জরুরি এবং সেটা নিয়ে কথা বলা জরুরি সেটার জন্য যা সাহায্য লাগবে হেল্প লাগবে সেটা পাওয়ার চেষ্টা করাটাও জরুরি এবং একজন কাউন্সিলরের সাথে কথা বলা একজন থেরাপিস্টের সাথে কথা বলা এটাতে কোনো মানে এটাতে কেউ মানে খারাপ কিছু হয়ে যাবে পুরো পরিবারের মানে কি বলবো যে মর্যাদা বা রেসপেক্ট বা কিছু একটা কমে যাবে যেটা আগে অনেক ধরনের এরকম চিন্তা ভাবনা ছিল এই যে চিন্তাগুলো এই যে বলবো ভুল ভ্রান্তি গুলো সেগুলো আসলে আমাদের ভেঙে দিতে হবে আমাদের কথা বলতে হবে আমাদের পরিবার হিসেবে একসাথে বসতে হবে আমাদের অ্যাওয়ারনেস রেজ করতে হবে আমাদের কর্মক্ষেত্রেও আমরা বলতে পারি যে আমার একটু সহায়তা দরকার আমার মানসিক স্বাস্থ্যকে ভালো রাখার জন্য আমি কাউন্সিলিং নিতে চাই এবং সেটাকে আমার হেলথ প্ল্যানের মধ্যে আনি স্কুলে কাউন্সিলিং ফেসিলিটি যাতে থাকে এই ব্যাপারগুলো আসা জরুরি এবং এই রিলেটেড আমাদের বেশ কিছু কোয়েশ্চেনও এসছে সেই কোয়েশ্চেনে যাওয়ার আগে বা কমেন্টসগুলোতে যাওয়ার আগে আমি বলতে চাই যে সাজেদার যা হচ্ছে তারা স্বজন আমরা এখানে দেখতে পাচ্ছি যে স্বজনের সাজেদার হেলথ হটলাইনে আপনারা ফোন করে আপনাদের যদি কিছু বলার থেকে কথা বলতে চান আপনারা আপনাদের মানসিক স্বাস্থ্য নিয়ে কোনো অ্যাডভাইস দরকার হয় সেখানে আপনারা ফোন করতে পারেন স্বজনের নাম্বারটা হচ্ছে 9678771611 কান পেতে রইয়েরও নাম্বার আছে এখানে 01985275286 আর সাজেদার হেলথ হটলাইন আছে 9678771511 এবং তাছাড়াও সাজেদার অকুপেশনাল থেরাপি যেটা রেসিডেন্সিয়াল সার্ভিস দিয়ে থাকে সেটা আছে এবং ট্রেনিং ফেসিলিটিসও রয়েছে এখন আমি একটু চলে যাচ্ছি যেহেতু আমাদের সময়ের স্বল্পতার কারণে আমাদের যে কমেন্টস এবং প্রশ্নগুলো এসছে সেখানে সেগুলোতে চলে যেতে চাই কোথায় পাওয়া যেতে পারে মেন্টাল হেলথ সার্ভিস বাংলাদেশে সেটা কিছুটা আমরা এখানে বলেছি আর কেউ যদি বলতে চান আমি বলবো যে আপনারা অ্যাড করতে পারেন তাছাড়া একটা comment এসে mental health issues must be dealt with meticulously so I'm looking forward to the knowledge I will gain from this discussion একজন লিখেছেন আমাদেরকে যে is mental health medication expensive তানভীর সিদ্দিকী জানতে চেয়েছেন we also have a question from Armin Danish who writes are schools taking mental health seriously so I'd like to put these two questions across before I go on to our next question. Actually, I'll just add on another one since we don't have much time. How do you handle students' mental health? They can't even share their depression. Fahim S. Tasin. I actually will not, point out these questions to anyone specifically here. Please, anyone feel free to take any of these questions. If you don't, I will give questions to individual speakers. Again, the first question was: is mental health medication expensive? Dr. Ashik Salim, I'd like for you to answer that.
Yeah, I think I'll take the medication questions because
Yeah.
I am a doctor. So in Bangladesh, generally, medication produced in Bangladesh is very inexpensive. Thankfully, because of our national policies, medication is very affordable. So mental health medication and widely available. So whereas in England and New Zealand there were certain medication which is very expensive and certain which is cheaper. In Bangladesh, the new ones, old ones, they're all just the same, unless you buy something very new and very specific, which actually in psychiatry there aren't many. So that's one question. It's not expensive. Shouldn't be. Locally produced medicine. If you try and buy medicine produced abroad, obviously it'll be more expensive. The second question about medication was should people depend on medication? Now, with this question, the answer is that if you have a diagnosed mental illness which requires medication, then you need the medication to get better, to either for as treatment or to manage your illness. So if you have diabetes, you need to have insulin to manage your illness. If you have high blood pressure, you have to have medicine. If you have an infection, you need an antibiotic to treat that. So if it's a properly diagnosed mental illness, and medication is necessary, then yes, you need to have medication. The idea of being dependent on medication is a little bit problematic because I have high blood pressure. I take medicine for my pressure, and I'm dependent on it because if I stop it, my blood pressure will go up. But I do it. I don't ask why I'm dependent on it. I just do it because I have to do it, right? So it's a little bit problematic to think of it that way. However, we need to become aware ourselves as patients of the protocols, the policies, what is recommended. The It's a very good organization in the UK called NICE, and they have all the guidance and patient information leaflets. And there's another organization in the UK called Mind, which has a lot of really good information. So it's a good idea that if your doctor doesn't provide this to you, you go and look it up, bring yourself acquainted to it, and then you can you can advise or you can ask for the proper amount of care. So these were the two medication related questions, and with it, I think I'll finish. We are running out.
So the next questions I'll leave it up to the rest of our speakers. One is, do you think schools are taking mental health seriously, and how do you handle students' mental health? They can't share their depression. These are from two different viewers. Hasina Mumtaz, would you like to address any of
Yeah,
these
sure.
questions?
Sure. Actually, we have seen that mental health of the students are very much vulnerable during this COVID time. As you know, that there was a 1.5 year loss, or their work from home. They have participated their classes from home. So this have a serious consequences that they are not going with their peers. They cannot play at will. They cannot. So there was some disruption in the child mental health, especially the adolescent mental health. And we also know that suicide is also one of the leading causes among the 15 to 29 years old. So if we consider these issues, these need to be addressed at the school level, so that they can cope with their school situation, as the schools are now open. So if they can cope with their situation, if they can cope with their studies, with their peer groups, how they can interact with the teachers, the students, with their curriculums, with their education, so this will have a great impact on that. And also what we think that schools are also, some schools they are also address this type of problem. And I can mention about some government initiative that are already mentioned in our national mental health policy and strategic plan. School mental health is already included. School means that the child and adolescent mental health problem is already included and addressed, and some action will be taken care of when this strategic plan will be implemented. And also WHO is working with the government to for another program, that is a school mental health program. And we are going to provide some type of capacity building and training program with the school teachers so that they can easily identify the persons who are vulnerable and who have a risk of suicide and who have the mental health problems. So this will be taken care of. I think that the schools, they have already addressed, as you know, some of the situation have already happened, some of the cases we have seen in the schools. So I think that this have already addressed and will be taken care of by the government very soon. Thank you.
Thank you so much. That is so good to hear. That's one positive thing. We have very little time, but just one question, Ms. Arman. You haven't spoken for a while. I'd like for you to answer this. How is Bangladesh's mental health plan focused on making mental health more accessible? Naya Arman has asked this question.
So like Hasinapa was mentioning, we've made sure that school mental health is something that's been addressed in our plan. So when we develop the priorities and the activities and objectives that we want to achieve with our plan, we've looked at the full life course of people. So starting from the very beginning, how do we normalize the topic of mental health in day-to-day conversation? How do we make sure that students feel comfortable talking in to their teachers or peers in school about mental health? How can you talk about mental health at home with your family members? So when we've developed our plan, we've made sure that these services can be accessible at the community level. And Bangladesh actually has a very robust healthcare infrastructure. So we're trying to incorporate mental health from the community level up. We have a very good system of community health clinics. We have our Upajala health complexes. We have our district hospitals. So we have put it in our plan to ensure that people are able to access mental health services at those levels as well. So we're hoping, if we're successfully able to implement our strategic plan, that more people will be able to access mental health services, and hopefully we can treat this inequality.
Thank you so much, Ms. Naza Sharman. Lastly, I'd like Mr. Mateen, if you have any parting words before I make my ending, concluding statements.
Yeah, I would probably like to talk about information, as in people need to know that they have a problem and that there is help out there. If you don't know where to get help, then it's a big problem, because you can get help with a 10 taka ticket at Dhaka Medical College, and then you can get help at, I don't know, 5,000, 10,000 taka places, right? And different things are appropriate for different people. So getting that information out there is probably fairly important. And the other thing I would like to say is sort of having mental health issues come up in movies and TV and things like that, I think is very important for normalization, and especially having proper characterization of these illnesses. So there's a US TV show called Homeland, and there's a CIA agent who is actually bipolar, and it's a very nice portrayal of sort of her life and her struggles as well. Uh, and if you look at media, now in almost every TV show, you just have a LGBTQ character, and this helps normalize these issues. So I think if we were, we might like think in these areas. That's
Thank you so much for that, Mr. Mateen. I think I couldn't have said it better myself. The way you've talked about the need for people to be able to access information, and I was thinking exactly the same thing about portrayal of mental health disorders or issues in our mass media, and how we, because that kind of shapes our thinking and our notions about mental health illnesses and disorders, and how one can address it, and face these situations in one's life. So I think it's a the media plays a big role in this regard. Unfortunately, our time today for today's webinar has ended, and we are at the end of this session. But it was so wonderful talking to all our speakers today. It was a great learning experience for me. To summarize, we talked about the disparities in access to mental health facilities and services for various people. Today's topic for Mental Health Awareness Day was mental health in an unequal world. So we talked about the disparities that are there. We talked about how we can try and bridge those gaps. As it was talked about, the information needs to be provided. We need to have a better representation of what it means to have mental health disorders in the media. We've heard about what the national mandate is, and we also heard about what each of us can individually do to help in kind of in this agenda or in this mandate to better the scenario for mental health services or mental health awareness in Bangladesh. On that note, I hope that we get to a day where we do not have this 94% and 92% gap for mental health to be mental health services to be provided to individuals, and I hope we can get to the day where we can bridge that gap, and we are all very committed towards bridging that gap. On that note, I'd like to thank all our speakers for attending today's session, and I look forward to seeing all our viewers in our next session. Have a good evening and a very good night, everyone. Goodbye.
Thank you.